All right. Well, thank you. Thank you, Lylan. Thank you, Doctors Data, for having me today. We've got a great lecture, great webinar today. It's something that's near and dear to me. It's something that I've been doing since I've been practicing from day one. Hormones are the harmony of the body. I even called my clinic the Harmony Healing Center because hormones are so important to the health of throughout the lifespan, both males and females. So we'll talk about testosterone specifically today, but really the hormones. It's a much larger topic that I delve into in my nutritional pathology course. But today, I'm really excited to present this information about testosterone, and we've got a lot of information to cover. So I'll just kind of go right through. Standard disclaimer: statements made in this presentation not been evaluated by the Food and Drug Administration. It's up to everyone here listening to take this information and use it wisely. So it's said that we live in an anti-androgen world, biochemically speaking. And indeed, testosterone imbalance affects both men and women throughout the lifespan. When I was in school, when I was in college, my physiology teacher was doing her doctoral thesis on estrogen and estrogenic compounds. And so I got very early the understanding and the awareness of how literally every chemical that we're exposed to throughout our lifetimes have an effect on the entire hormone and neuroendocrine system, but specifically, most of them are either pro-estrogenic or anti-androgenic or both, and many of the receptors compete with each other. So we do literally live in an anti-androgen world. What we've done, everything from plastics and phthalates, beauty products and food packaging and food colorings, everything is affecting our neuroendocrine system. So we'll cover the multiple roles that testosterone plays in almost every aspect of human health, from neurological, cardiovascular, throughout the lifespan. So obviously we only have an hour today, so I'm not going to give you, become an expert after today's webinar. But hopefully my intent here is to pique your interest, to understand how to treat your patients better. Even after this one webinar, you'll have tools that you can walk away with, start using tomorrow with your patients. And like I said, I've been doing this for over 15 years. And so I know these things work, and I've got the evidence to present to you today. So I'm all about rejuvenation and restoration of the hormone system rather than replacement when possible. So I'll talk a little bit about replacement versus rejuvenation and restoration. So let's go right into things that we can take away and use, on our patients immediately. So the outline will go into the physiological role, some of the causes. I'll delve into the causes of low testosterone, both from a medical standpoint, what are some of the major causes like traumatic brain injury, but also what are the functional causes like diet and these chemicals that we're exposed to. We'll talk about the dietary, lifestyle, and supplemental treatments for low testosterone. I'll talk about the proper use of testosterone replacement if warranted throughout the lifespan. And then I'll go through a really good case study that highlights everything that we're going to talk about today. So quick overview of testosterone. It's secreted in the adrenals, the ovaries, and the testes. Testosterone is actually the most abundant hormone in both males and females. Increases libido in both males and females. Testosterone in females is secreted in surges around ovulation and by the corpus luteum before menses. So it explains the increase in libido reported around ovulation. So without proper testosterone signaling, then it's going to affect fertility. It's going to affect libido. Decreases sex hormone binding globulin itself, and then increases free hormones, other hormones. So without testosterone, other hormones get affected. They all live in concert and act in concert with each other. It's a pro-growth hormone, obviously. Really important is that testosterone itself initiates sexual differentiation in the fetus. There really is actually double the amount of testosterone in females than males through puberty. And without that testosterone signaling, especially in the womb, especially in the fetus, then the brain does not get developed properly. So we'll talk about that as well. Obviously, benefits of testosterone in men, develop the characteristics of masculinity, libido, stamina of the mitochondria. We'll talk a little bit about the mitochondria and how important that is in both steroidogenesis, making testosterone in the body, but also implementing the testosterone signal and hormone signals. Remember what a hormone does in the body. A hormone, the definition of a hormone is a chemical that's secreted by one tissue and has actions on another tissue. How does that testosterone have actions? It has actions through the DNA, right? It has actions on the mitochondria and the DNA. That's what hormones do, is it affects how DNA functions and how the mitochondria functions. So when we look at functional endocrinology, and this is a theme throughout today we'll talk about. When we look at functional endocrinology, remember that we're not just concerned about levels in the blood or in the saliva. That's only one aspect of functional endocrinology. We want to look at the HPA axis, the hypothalamus and the pituitary. We want to look at how that testosterone receptor is functioning, how the testosterone and other hormones get transported through sex hormone binding globulin and thyroid binding globulin and albumin, how that receptor is functioning, what the translation of that receptor is, and then how the counter actions of those testosterone, how do those hormones actually shut off? And then finally, bioelimination and transformation, biotransformation and elimination of those hormones. So we'll talk about enterohepatic recirculation and all of that. So remember, functional endocrinology is much more vast than traditional endocrinology that's just looking at the levels of hormones and free hormones. When we talk about how we treat in functional medicine, we have to remember that we treat that entire process. So we want to optimize receptor function. We want to optimize production. We want to optimize secretion and transportation, optimize DNA signaling, and optimize the biotransformation and elimination. So just keep that in mind throughout this webinar. Benefits of testosterone in women, important for sexual function, ovarian function. Without testosterone, the ovary has a hard time leaving. If there's too much testosterone, then we get into PCOS, and we'll talk about that a little bit. Bone and muscle growth, and also the mitochondria, and influences mood, brain activity, emotional health, along with other androgens too. So not just testosterone, but DHEA, androstenedione, and other androgens. In the female, testosterone is needed to prime the follicle for egg release and ovulation. So without testosterone, temperature will not rise as much during ovulation. So if you find a female and their testosterone is low, then it's going to be hard to practice that timing method and know when they're ovulating as well. So and the egg may not be released at the proper time. So in the fetus and in pre-pubescent, testosterone is needed for clitoral maturation and function. So testosterone and these chemicals that we're exposed to in the womb, it's linked to lower female sexual satisfaction if testosterone isn't present in enough amounts during gestation and puberty. Needed for red blood cell production as well, and also hair growth. Many women have low testosterone, but then relatively high DHT, which is actually causing their hair loss. Everybody likes to blame the thyroid. And yes, there's a lot of thyroid issues. That's a whole nother, webinar. But I see probably, at least 30% of women that complain of hair loss. It's actually due to too much DHT, too many chemicals in the body affecting testosterone production and inflammation. And we'll talk about inflammation coming from the gut that actually produces more DHT, which can be a problem for both males and females. So gut health is extremely important when we talk about testosterone and hormones. And testosterone modulates other hormones such as estrogen and progesterone. There's a lot of studies that show that if you have low testosterone and a lot of chemicals that act like proestrogens, testosterone, all steroid receptors have some affinity for each other, even cortisol. So if you have high cortisol, that's going to attach to the testosterone and estrogen and progesterone receptors, and it has different actions on that receptor. So without testosterone, you may likely be more estrogenic or estrogen dominant, and progesterone may not work as well. So having testosterone is important for modulating all the other hormones, not just in and of itself. And we'll get into adrenal function and why, if you have high cortisol, really that's what's going to affect testosterone function the most in both males and females. You can have normal testosterone levels in the blood or in saliva or urine, but if you have too much cortisol, then that's going to block the testosterone receptor. So it's really important to address the entire HPA-G T axis when you're looking at hormones. Never look at just one hormone by itself. That's one of the things that drives me crazy about some of these fertility clinics and, low testosterone clinics and stuff is you can never assess testosterone just by itself. So in this study here, testosterone in the brain from cognition to autism, it's important to know that the surge of testosterone in male fetuses between the 16th and 24th week of gestation mediates the organizational effect. And what we mean by organizational effect is that testosterone in the womb is what actually produces the organization, the structure of the brain. Why is autism 5-to-1 male to female? It's because the testosterone signaling is imbalanced in the womb. And so that organizational effect, the structure of the brain does not become proper. It does not become robust. And it's due to all these anti-androgens and the chemicals and cortisol and everything that we're going to talk about today. That's why this is one of my passions. Truly, if we're going to have a healthy species, we have to address this hormonal imbalance and disorganization that we're seeing. That's why, it is 5-to-1 male to female. And testosterone is needed more for male brain organization, but just as important for female organization as well. So we've got the organizational effect of testosterone, but then we have activational effects. So this is, postnatal and throughout the lifetime. Testosterone doesn't create the structure of the brain anymore. 90% of the structure of the brain is already done by the time the baby is born. That's why these perturbations in the womb are irrevocable. They are irreversible. And that's why it has to be addressed before gestation. So preconception planning is so important. And it's something that I talk about a lot in my classes, and I do a lot in my practice. So the critical period for cyclicity induction in girls is around the pubertal transition. Again, pre-puberty, testosterone is the most abundant hormone for females. And if we don't get that testosterone signaling, then it can affect aspects of fertility and brain function throughout that girl's lifetime. And then later in life, testosterone is found to influence behavior. This is the activational effects. How does it activate certain neurotransmitters? And testosterone dampens astrocytes, which is astrocyte and microglial activation is part of the pathogenesis of Alzheimer's and dementia. And so if you don't have enough testosterone throughout the lifetime, or even later in andropause or menopause, then you're more likely, you're more susceptible to develop cognitive decline. So this is kind of the activational effect of hormones. And we know progesterone is important in that, and estrogen as well. But they all tend to mirror each other in some way or another. So there's a lot of different, different actions and influences on testosterone. So here, this is just a schematic from that same study. Excuse me. So we've got chromosomal difference. We've got SNPs that we'll talk about, a few SNPs that affect testosterone production and signaling, whether you're males or females, the timing. your diet. So the plant here, this plant, the phytonutrients are actually precursors to testosterone, DHEA. Plants have saponins that the body converts into DHEA. So if you're not eating enough vegetables, if you're not eating a good clean diet, then there's no way you're going to have proper hormonal balance. Not to mention the influence of diet on the microbiome and recirculation of these hormones. And then again, testosterone is produced, medications affect that. And then we have 5-alpha reductase, we have aromatase activity, sex hormone binding activity. This affects how the testosterone is activated in the body and the receptor function. And then it affects the brain, it affects organizational effect, cognition, fertility, and cancer risks, and all of that. So testosterone affects spatial ability of the brain specifically. The rate and susceptibility of autism is linked directly to not just testosterone levels, but again, the amount of chemicals that are in the womb of the fetus, that are in the womb that the fetus gets exposed to. It's responsible for axonal pruning in callosal tissue, which any of you are neurologists out there, it's integral for sensory coordination, emotional, analytic, and intuition. So without testosterone and other androgen signaling, then our levels of emotional ability and intuition suffers. Mating behavior, limbic regulation, reasoning and intelligence, motivation. Testosterone is a dopamine agonist. So if you don't have enough testosterone, you can support the dopamine system all you want, but without enough testosterone, it's not going to be very effective on motivation and in fact, many drug-seeking behaviors and gambling and stuff both produces low testosterone, but then low testosterone actually creates more of that behavior. So, and of course, again, memory and cognitive decline in later years. So indeed, we're seeing an epidemic of testosterone imbalances throughout the lifetime. And why is that? So is low testosterone, should testosterone decline throughout our lifespan? It certainly seems that that's what's happening, but is that what is supposed to be happening? So here is some studies that were done at looking at median levels of testosterone throughout the lifespan. And you can see here both the mean and the median. It does not drop that much in healthy males. We don't see a big drop. And so I had a question earlier of, what are healthy levels? What should they be? Again, it's not just about levels, it's about the function of the testosterone and removing the anti-androgens in the body. But certainly when we look at the levels of the testosterone, it should not decline that much during the lifespan. So I look throughout the entire lifespan, optimal levels for me are 550, 600 to 800. And it can be more than that. That's fine, as long as it's not getting into testosterone dominance as well. But that's like in PCOS. But we see here, sex hormone binding globulin should also not fluctuate too much. It's going to go up as you age a little bit, but it shouldn't go up that much. So the amount of free testosterone should be, around 9 to 10% or more throughout your lifespan, at least. And we see that. These studies have been going on for a long time. Frederick von Saal, University of Missouri, and Dutch researchers, they've been doing this research for 30, 40 years, showing that testosterone levels have been declining since the 50s, largely because of the chemicals in our environment at about a rate of what we're seeing now, about 1% a year. So we're already at about 50% less than we were, 50, 60 years ago. And we are losing about 1% of sperm count and motility every single year. So this should sound as an alarm. We need to get this information out and also treat it. There's lots of things that we can do. We're not just sitting ducks, as it were. So what are the signs of low testosterone? One of the questions is that we had is, Do we just rely on levels in the blood and the urine and saliva? No, we can't, because there are many cases where you have normal levels, but you're still exhibiting the symptoms of low testosterone. Why is that? Because of the functional endocrinology model. The DNA may not be working properly, the mitochondria may not be working properly, and the receptors may not be working properly. So you have to look clinically. You can't just rely on the labs. You have to be a doctor and look at the entire clinical picture. So depression, fatigue, low libido, irritability, headaches, erectile dysfunction, this midlife existential crisis, decrease in body hair, testes and penis size, loss of muscle mass, endurance, increase in breast tissue, anemia in both males and females, and emotional lability. Obviously, nobody's going to have all of these, and there's many causes for each one of these individually. But when you start seeing the bigger clinical picture, then that's what clues you into, okay, we've got some hormonal and testosterone imbalances. So obviously, the major causes of low testosterone, of hypogonadism, endocrine disruption from chemicals, pharmaceutical exposure in utero and throughout the lifespan. We'll talk about that more in a second. Testicular injury, so mumps, viral infections, injuries to testes from accidents, surgery, cancer. We're actually seeing with all these chemicals, and we're seeing a greater incidence of cryptorchidism, which is undescended testes. And we're seeing that, more and more, and undescended testes relates to low testosterone throughout your lifespan, infertility issues, things like that. And so a lot of kids are having to undergo surgery to artificially descend the testes. We have genetic abnormalities like Klinefelter's hemochromatosis can also damage the testes and relates to low testosterone function. Statin drugs lower testosterone and other hormones. Previous steroid hormone use, such as performance-enhancing drugs, but also all these kids that have asthma and allergies, and they're given massive amounts of steroids and inhalers. That's going to affect. That actually shrinks the size of the testes, shrinks the size of the clitoris and the ovaries in females as well. So and most causes of asthma are in the womb, inflammation in the womb, and also the microbiome. So the mother of the diet is the number one predictor of whether a child's going to get asthma. But I go much more into all of the preconception things in my nutritional pathology class. But antidepressants, obviously chemotherapy, high blood pressure medications, a lot of medications are responsible for these hormonal imbalances. Traumatic brain injuries, damage to the hypothalamus, pituitary structure can also lead to this impaired neuroendocrine regulation. So these are things that we want to look at the entire clinical picture. I use a lot for hormonal imbalances, especially for traumatic brain injuries. I use hyperbaric oxygen a lot in my office, and that's been shown by itself just to increase testicular size and testosterone levels. But so we also have these functional causes of low testosterone. Why are we seeing such a rapid decline in healthy testosterone levels? Not just these major, medical diseases, but these functional things that we're seeing on a daily basis. So indeed, diet is probably the number one cause of low testosterone, not the only, but it increases adipose tissue, which then will elevate aromatase enzymes, and aromatase enzymes will take testosterone and convert it into estrogens and other hormones, progesterone as well. Insulin resistance is this main etiology. That's what we really need to work with, is insulin resistance. Insulin resistance itself increases adipose tissue and interferes with pituitary function. But it's insulin resistance. And we all know, or we should know by now, that the number one cause of insulin resistance isn't just, your Cheetos and your chocolate cake, which is a big cause of it as well, but it's actually leaky gut. Leaky gut is what precedes and is a prerequisite for most insulin resistance and diabetes, both type 1 and type 2. So that's really something that we should be looking at in both our males and females. In this study, the association of free testosterone levels, men and lifestyle factors. So we see that insulin resistance causes hypogonadism, causes elevated sex hormone binding globulin, elevated estrogens, all of these. So estrogen, again, will increase sex hormone binding globulin, whereas testosterone tends to lower it. A good surrogate test for sex hormone binding globulin is actually your T3 uptake. So T3 uptake, if it's low, that typically means that your sex hormone binding globulin is elevated. So if anyone wants to understand the physiology of that one, again, you take my classes. You can watch my webinars and videos, but I go into that. But we see that diet is one of the main causes here of elevated sex hormone binding globulin, hypogonadism, and testosterone in males. So, and it's what produces contributes to cardiovascular disease as well. So again, we see the elevated aromatase enzymes, and it siphons off testosterone, produces more estrogen, and estrogen will actually, a lot of estrogen will suppress luteinizing hormone in the male. So then you get lower testosterone production as well. So we'll talk about some aromatase inhibitors. But again, we want to always treat at the cause. We want to not just treat the effect, which is elevated estrogen. We want to treat the cause, which is insulin resistance. It's one of the main causes here. Another big issue of declining testosterone levels throughout the lifespan is the adrenal function. So hypercortisol. I already talked about how many studies show that, that if you have elevated cortisol, that's actually going to produce symptoms of low testosterone. I read one study, I didn't include it here, but I read one study that just going for a walk, with your back straight, going for a walk and bringing your shoulders back and doing some deep breathing, that lowers cortisol levels by about 30% and increases testosterone levels by about 25%. So just by doing some simple things throughout our day. But how many people are stuck in front of a computer? They're hunched over, they're not breathing properly. Their cortisol is getting secreted throughout the day. So remember, it's not just about testosterone levels. We want to make sure cortisol levels are good as well. The other thing that happens is over time, we get adrenal fatigue. So we get that pregnenolone steal, right? So the body will steal pregnenolone, and that's what we see. The body will steal pregnenolone in favor of production of cortisol, but we don't get the DHEA production and androstenediol and testosterone and the estrogens. So that is always survival before sex. That's a principle of endocrinology that we learn in day one. So if we're in survival mode, there's no way our sex hormones are going to be and our sexual function is going to be optimized. And we also get low aldosterone. So we get things like high blood pressure, low blood pressure. We get, blood pressure abnormalities. This is also implicated in POTS syndrome and other things. So it's this pregnenolone steal that happens and the autonomic nervous system imbalance. POTS syndrome also has testosterone imbalances. I want to remind everybody that steroidogenesis happens in the mitochondria and the endoplasmic reticulum. So when we have imbalances and perturbations of any hormone production, we must look at the mitochondria and support the mitochondria. I've been in practice, almost 20 years now. And the more I study, the more I research, the more I've been doing this, the more I see just the primary importance of mitochondrial health. So in this study kind of shows a little bit of that. So influence of lipoic acid, which we all know is a very potent mitochondrial support agent. So influence of lipoic acid on testicular toxicity induced by phthalates. So we know phthalates, they actually use phthalates to induce injury to testes in animals. That's how potent it is of a HPAG axis disruptor. So just by giving lipoic acid along with the phthalate, it attenuates most of the damage that the phthalates inflict. So So we want to, lipoic acid is something that I use myself every day. We can't eliminate our exposure to some of these things entirely. So lipoic acid becomes pretty important in our daily regimen. So it quenches the free radicals. It actually increases testicular function, size, and weight of the epididymis. Some of the other causes of low testosterone, like I've talked about already, estrogens and estrogen mimics. Just like my physiology teacher back in college, he did her entire PhD dissertation on these xenoestrogens. So they're ubiquitous and they are potent, and they're potent at parts per trillion. So I always like to give this analogy when we talk about estrogen mimics and xenoestrogens. So one of my favorite books, one of the books that's actually, changed my career, I read it 10 years ago, is Our Stolen Future. I think everyone should read that book. I think it's one of the most important books of our time. And it's more important now than it was when it was written 10, 15 years ago. But these chemicals that we're exposed to on a daily basis are biologically active and biologically damaging at parts per trillion. Parts per trillion is hundreds, if not thousands of times lower than what the EPA levels set as safe, okay? So imagine part per trillion, imagine a 6-mile long train, okay? A train that's 6 miles long. Every cart has a tanker. Every tanker is filled with water for 6 miles, right? You're sitting at that stop for a long time, watching that train go by. So if we see that 6-mile long train and we put 1 drop of water compared to all of those tankers of water, that's a part per trillion. And so minute exposures to these xenoestrogens have extremely detrimental effects and long-lasting effects. So, and some people are more sensitive to them than others. That's where we start getting into some of the genetic SNPs. If you have COMT genes and MTHFR gene SNPs, we're going to see that those people are going to be the canaries in the coal mine, if you will. I don't want to get too much into SNPs, but what I always want to remind the doctors out there, practitioners, is that if you practice genetic medicine, if you run SNP testing on your patients, please, please, please remember, never treat a SNP by itself. SNPs should not be treated in and of themselves. You have to see whether they are phenotypically being expressed. How do we do that? We do that through our clinical evaluation and our laboratory evaluation. So all of these programs that allow you to upload your 23andMe data, and then it spits out what you should be taking in terms of supplements, that is bad medicine, and it's actually, there's no scientific evidence for that. However, what it does say is if you have MTHFR, if you have these SNPs, then if you have then nutritional deficiencies or these exposures or these lifestyle and dietary factors on top of it, then it's likely to be more damaging and more disease producing for you with that SNP. So the treatment of those SNPs becomes more important if it is clinically necessary. So I hope that makes sense for everybody. It should be a guide, but we should never rely on SNP testing to supplement our patients. So in this study, intrauterine exposure to acetaminophen. So women are told, don't take herbs, right? Oh, don't take that St. John's wort for depression because we don't know how it affects the fetus. But go ahead and take Advil and acetaminophen. I read a study that showed that taking one acetaminophen, one Tylenol, lowers your hormone levels for 48 hours, the equivalent of 50 years of aging. So your pregnenolone, your testosterone, your estrogens, everything goes down. Why would we subject a pregnant woman and their fetus to that? So we see that dose dependently, it's associated with the cryptocortism and low testosterone, autism, and things like that. So we really want to be aware of some of the natural alternatives to what these medications are used for. So xenoestrogens and declining sperm count. So Tylenol is a xenoestrogen. The ratio of men to women being born even are being affected now. And many believe that toxic estrogens are the cause. So we're seeing more women being born than men because that testosterone initiation never happens or it gets impaired. And we're seeing a lot of ambiguous genitalia and things as well. So that's something that we can help. We can mitigate through preconception planning. One of my favorite books is Countdown by Shauna Swan. Again, just this book describes what we just talked about, that if the fetus is exposed to any of these anti-androgens or proestrogens, then the size of the penis and the other parts of the genitals are affected, both in males and females, but certainly for males here, she focuses on males and sperm counts in this book. But she measures the anogenital distance. So if you're exposed to phthalates and BPA and medications, then the anogenital distance shrinks, and the anogenital distance is the number one predictor of sperm count and fertility, mating behavior, autism, all of these, risk for cardiovascular disease and all of these things. So what can we do about it? And, she goes into some of it, but we'll go into it more the rest of this webinar as well. But again, during the 8 to 12 weeks of pregnancy is some of these critical windows. Other things affect sperm counts, like we talked about diet. If you're eating full fat dairy foods, if you're eating a lot of processed meats, if you're drinking sugar, a lot of sugar sweetened beverages, caffeine, all of these affect sperm motility and sperm counts and testosterone levels. So solutions for endocrine disruption. We have to increase public awareness, and I hope all of you are interested in preconception planning. That is in one of my modules for my nutritional pathology course. It's module 5. I go into preconception planning. I think it's the most urgently needed and desperately absent in our healthcare system today. And so with the rates of infertility continuing to rise, with the rates of autism and other congenital defects continuing to rise, it's urgently needed. Initiate your functional treatment paradigm, right? Avoid endocrine disruptors when possible, educating your patients and the public, and then doing mitigating things like alpha lipoic acid, quercetin, N-acetylcysteine, things like that. Do your detoxification program, infrared saunas and exercise and sweating, air purifiers, water purifiers. This isn't a detox lecture, so just wanted to remind everyone that we have alternatives. We have answers. We have things that we can do starting today, starting right now. So now let's get into some novel and effective nutritional support that we can do for testosterone. Testosterone, not just testosterone production, but the entire functional endocrinology model. Testosterone secretions, testosterone transportation, testosterone receptor function, the DNA, the mitochondria, the bioelimination and transformation. So let's go into some of the things that we can do. Obviously, we talked about the anti-inflammatory diet. If anyone's interested in my anti-inflammatory diet, you can go, it's part of my course. You can go to my website and download my anti-inflammatory diet. So we have some studies here that calorie restriction increases serum testosterone concentration. So practicing calorie restriction, increasing high quality protein, good fats, being in ketogenesis or ketosis is very, very healthy for testosterone levels. Exercise. The way I practice and the way I teach and how I teach my doctors how to be really effective at these kinds of treatments is to remember the three-legged stool. Okay. If the three-legged stool analogy is appropriate, because you can't have just one leg or two legs. You can't make up for a missing or weak leg by having a strong other two legs. For that entire stool to work properly, you've got to have all three legs. So the three legs that we talk about in functional medicine is, the first one is diet. The second one is supplementation. And the third one is lifestyle. So your exercise, your relaxation response, meditation, proper sleep, your social habits and relationships, all of those things. But treatment plans will not work unless you have all three. So I do a lot of consulting for other doctors, and typically when I see patients not get better, it's because all three of those legs aren't there. Okay. So we have supplementation, stress reduction, again, reducing the cortisol shunt through the relaxation response and mindfulness. We have a lot of tools also in our nutritional tool bag. And I'm going to go through some really, really powerful ones. One of my favorite is cordyceps. Cordyceps got popular through COVID because it helped with symptoms of COVID. But it does so because it increases testosterone and other hormone levels. And hormones, as we see, are the reason why elderly are more susceptible to COVID deaths and morbidity, because they don't have the hormones that are necessary for proper immune signaling. So cordyceps increase the epididymal weight of the testes. It increased testosterone levels. It increased free testosterone. And it really, you don't need a lot. I mean, 5 milligrams per kilogram was very effective. In this study here, we look at some 5-alpha reductase inhibitors. So if you see that the DHT levels are elevated, if you see, other clinical signs of DHT like prostate enlargement or, hair loss, especially hair loss on the distal parts of the legs and things like that, then we used to think saw palmetto was the only game in town, right? Saw palmetto is not even the most effective. It's effective, but we've got EGCG, which is one of my favorites, which is a green tea extract. We have quercetin, caffeic acid. We have sulforaphane. Lots of things at our disposal. So. This other study on cordyceps, it increases luteinizing hormone, and cordyceps significantly stimulated in vitro testosterone production in and of itself, both in vitro and in vivo. So it works, we have many different mechanisms and proof that it does work. And like I said, you don't even need that much. Usually I use about 600 to 1200 milligrams of a good standardized cordyceps supplement. I'm not going to mention any supplement by name in this lecture, but for those of you that are interested in what I use in my practice, I'll give you my contact info at the end of this lecture, and you can contact me, and I'd be happy to share with you what I use in my practice. So another study on cordyceps and how important it is. It also helps corticosterone. So it's really important in adrenal fatigue as well. And it does so, it actually protects the adrenals and the testes by increasing glutathione. So it protects the entire HPAG axis. We have a lot of other T renewing herbs. Some of my favorites are Tribulus terrestris. It balances testosterone levels, sexual function, homeostasis, supports the immune system, blood sugar levels. I mean, many, many studies on this, lipid levels, cardiac and nervous system function, liver enzyme, lowers liver enzymes, supports muscle contractions and muscle size, ability to enhance absorption of other nutrients as well. Maca is another adaptogen that I really like, positive effects on sperm motility and fertilization rates. Remember, half of all infertile couples, infertility, it's due to this testosterone and lower sperm counts and lower sperm motility. So if you see males with abnormal morphology, which we're seeing, I mean, it truly is an epidemic. Almost every male that I've treated in the last 15 years, when I do a sperm analysis on them, almost all of them that haven't been practicing functional medicine in their life have abnormal sperm counts and abnormal morphology. it's almost a given. It's like the old vitamin D saying, right? If you're not taking vitamin D, we can assume that you're vitamin D deficient. That's pretty true in this case. Saw palmetto is a potent 5-alpha reductase inhibitor as well, so we do want to use it, but it also increases testosterone levels by increasing epididymal weights as well. Sunflower lecithin is good. Lecithin, phosphatidylcholine, phospholipids. Not only are they good at helping other herbs get absorbed, but they increase the HPAG axis function necessary for the hypothalamus and the pituitary. So we have fenugreek. Fenugreek actually has DHEA and testosterone-like compounds that's safe. The only thing you need to be careful of is if you're treating an athlete, if you're treating a professional athlete that gets tested for performance-enhancing drugs, there's been some anecdotal reports that if you're eating a lot of fenugreek, that can cause a false positive on testosterone levels if they're being tested. So I treat professional cyclists and triathletes that get tested a lot. So we have to be careful with some of these, but I use these for them as well, just supporting natural testosterone levels. Chrysin is a really potent aromatase and enzyme inhibitor. So we'll talk, we talked about aromatase enzyme. Tongat Ali supports homeostasis of DHEA, testosterone, progesterone. Cortisol lowers aromatase enzyme activity. It's an adaptogen. It counteracts the xenoestrogens. So I really like Tongat Ali in my regimen. Horny goatweed, probably named horny goatweed for a reason, right? Somebody figured that out a long time ago, that if you eat this weed, you're probably going to be horny as a goat, as the saying says. So it also supports for joints, energy, cognition, blood flow, heart, lung, bone, and liver. Horny goatweed actually lowers cholesterol, very, very healthy for cardiovascular parameters. And then here's some studies. I don't want to spend too much time going over these because I want to get to the case study, but I wanted to provide them for you just so you know that, we have plenty of evidence-based. Quick story. I had a patient who, she has cancer and we're helping her through cancer. And she went to the Duke. Hopefully I don't have anyone from Duke here listening in, but she went to the Duke Medical Center, their Center for Integrative Medicine. And she walks in there and, she's hoping to get some support for her chemo and things like that. And some acupuncture and things. And she brought her list of supplements that we have her on. And, the first thing the doctor said, and this is supposed to be an integrative medicine doctor, the first thing the doctor said to her, in a quite shaming way, by the way, was, oh, well, we don't do herbs because there's not enough scientific evidence. What we do is evidence-based. We're evidence-based. We only do evidence-based. You shouldn't be taking those. They're not evidence-based. Evidence-based, evidence-based. So the only thing after almost 20 years of practice that still gets me going and kind of sticks in my craw, so to speak, is when someone says there's no scientific evidence for this. Just because you haven't seen it, just because you haven't spent the time and the energy like I have for my entire life researching and studying the scientific evidence doesn't mean that it doesn't exist. And let's all remember the primary detriment to scientific advancement, which is contempt prior to investigation. So where are these people going to go for truly evidence-based, functional medicine? That's up to us. And that's why I've developed the nutritional pathology course. We need a place to go that has the evidence-based, clinical protocols and trials and things that are known to work. So that's been a passion of mine for the last 15 years is creating a course where all of you can be assured that somebody has done the evidence-based research and you get to partake in it. So we've got Tribulus terrestris, an improved libido. It actually decreases pain. And we're talking about sexual pain here. It increases lubrication for females. So it improved libido in both males and females. It actually helps with menstruation as well. Female sexual dysfunction, including hypoactive sexual desire disorder, sexual arousal disorders, orgasmic disorders. It's estimated that about 35 to 40% of women do not, cannot have regular orgasms during sexual intercourse. And a lot of it is because of these androgens and the testosterone imbalances. Remember, testosterone is needed for clitoral development in the womb and pre-puberty. But even post-puberty, we can do these things like tribulus terrestris, and it will increase serum testosterone levels. And after just 1 to 3 months of treatment, both pre and postmenopausal women had significant increases in sexual function scores. 12 weeks, 1,500 milligrams of maca versus 3,000 milligrams. So we're not talking extremely large doses, but within 4 weeks, the decreased sexual desire complaint decreased, and so sexual desire increased, but in both men and women. And we see here that at 8 and 12 weeks, it went up at 4 and stayed high at 8 and 12 weeks. So maca improves sperm production, sperm motility, serum volume, favorable effects on energy and mood, decreases anxiety, improves libido. Maca is a potent antioxidant and immunomodulator as well. I've used maca for COVID and COVID-related cases as well. Here's saw palmetto, relieves andropause symptoms, prevention of testosterone deficiency, improves muscle endurance, sperm counts, and testosterone biosynthesis. So it's not just a 5-alpha reductase inhibitor. Here's the fenugreek seeds. Again, it's got these saponins. This one has protodiosine, which can be converted to DHEA. But almost all plants have these sterols and saponins that are needed for production of our fat-soluble hormones like vitamin D and also DHEA. So low DHEA is usually adrenal fatigue, and it's bad diet and an abnormal microbiome. So that's what needs to be treated. A good doctor knows what to do. A great doctor knows why. That's why I go into understanding the pathophysiology of these things and how these things really work. So, I could, this webinar could be 5 minutes if I just gave you the protocol and said, hey, it works, trust me, and some of you will do it, some of you won't, but and most of your patients will be like, well, why should I trust you? So a good doctor knows what to do, but a great doctor knows why. And that's what I focus on in my training and my courses. So here is, Trigonella as well. And another study for the fenugreek, improved testosterone levels, morphology, motility, sperm counts. Chrysin reduces estrogen production because it's an aromatase enzyme inhibitor. Here's Tongat Ali. It stimulates release of free testosterone, improves libido, reduces fatigue, and improves well-being. It reduces salivary cortisol. If it's high, it will not reduce it if it's low. Just like phosphatidylserine will not reduce cortisol levels if it's too high, or will not reduce cortisol levels if it's low or normal. It'll only reduce cortisol levels if it's too high, because it restores proper hypothalamus positive and negative feedback loop. So ashwagandha is also really important. We have mucuna and ashwagandha. So not just tribulus, but we have other things as well that increase sperm motility, volume, and count. Now, instead of giving your patients, all of these things, I use some all-in-one testosterone support formulas. So again, if you want to email me or sign up for my classes, I give you exactly what I use in my lectures and in my practice. Sorry, just plugging in my. Let's see. Here we go. Sorry, I have to plug in my computer. Let's see. Okay. Should be okay. Okay, there we go. I don't want to lose everybody. We're getting to the good part here. And then I would be remiss not to mention methylation and its important role in testosterone and other hormone production and function and bioelimination and biotransformation and elimination. So elevated serum homocysteine, it's again, homocysteine is a marker of not methylating, but homocysteine in and of itself damages the testes. It creates cardiovascular disease. It damages the pituitary. Now, I want to remind everybody that just because someone doesn't have elevated homocysteine, it doesn't mean that they're producing enough methylation. Homocysteine is a rule-in test. If you have elevated homocysteine above a 7 or an 8, then you know that you're not methylating properly and you're damaging the testes, you're damaging the cardiovascular, you're damaging the brain. I've seen studies that show that a homocysteine above a 12 shrinks the brain at about 3% a year. So it's really important. And we're seeing more and more methylation. But remember to run a plasma profile, run a level of your SAMe, because many people with low homocysteine or normal homocysteine still aren't producing enough SAMe, and SAMe is needed for all of our steroid hormone production. But this study just shows that in erectile dysfunction, someone with even just a heterozygous, but if you're homozygous, you have almost a 4 times greater odds ratio of developing vascular erectile dysfunction, right? Because there's vascular and then there's neurogenic erectile dysfunction. Neurogenic is more along the lines of, brain function and autonomic nervous system balance. So given what we now know, is testosterone replacement the only answer, right? It might be an answer, and it might be appropriate for some people. If testosterone is needed as a medication, then there's kind of a better way to do it and a not so good way to do it, which we'll talk about. But really, it should only be used for a short amount of time to sort of prime the pump, so to speak. Because the longer you're on it, obviously, the smaller your testes will become, and what happens is a testosterone receptor shutdown. So we're given, we're in the media, and certainly if we just rely on our primary care providers or endocrinologists, this is an ad, end sexual dysfunction, alleviate prostate problems, regain muscle loss, restore energy, improve memory. That's all true, but is taking testosterone as a medication really the best way to do it? We always have to ask why. A good functional medicine doctor asks 3 questions: why, and why, right? Why does somebody have low testosterone? Okay, maybe it's their adrenals are dysfunctional. Why are their adrenals dysfunctional? Because they have inflammation. Why do they have inflammation? So that's where you start getting into the true causes. One of the problems with testosterone administration is it becomes hyperpulsatile. So when especially if it's intramuscular, which is a common form of testosterone replacement. So when you get testosterone as an intramuscular or even as a patch, you get a very high amount, extremely high amount in the blood. What happens there is you get testosterone receptor downregulation, right? That's a principle of functional endocrinology, of all of endocrinology. If you have too much of a hormone, the body's going to protect itself by downregulating its sensitivity. It's one of the reasons why we get insulin sensitivity. Too much insulin, the insulin receptors go down, function goes down. And then as it goes down, now the person is even worse off down here because the testosterone levels, endogenous testosterone levels, are even lower, and the testosterone receptors are even lower. So it's really doing a lot of damage. And I've got many studies here, just one quick study here, that when you give testosterone therapy, you're actually in older men and in younger men with pre-existing heart disease, the risk of myocardial infarction following testosterone replacement is substantially increased, about 3-fold. So So there's better ways to do it. So, and there, it doesn't mean that you don't want to do it, but there's better ways to do it. I usually do either a troche, a sublingual, or a gel. The only problem with gels is that you have to be careful about cross-contamination. I have actually seen that where their children and or wife, if they don't wash their hands, can become cross-contaminated, and so their 12-year-old dog starts acting like a puppy again. So you got to be careful about that. So let me go through this case study. A 57-year-old male presents to my office with lingering fatigue, joint pain, brain fog, shortness of breath, and cough 1 year after COVID-19 infection. Everything started when he got contracted COVID-19. Normal BMI, was previously a quote unquote healthy adult with no, elevated blood pressure, medications, worked out daily, was successful at his occupation as a marketing director. He contracted COVID-19 in March of 2020. So he's an early adopter, like myself. I got it in March 2022, traveling. And he had a pretty bad case: fever, fatigue, anosmia and ageusia, respiratory distress. And he didn't go to hospital because back then, that's where you went to die. Symptoms did not improve much afterwards. And so he had this just lingering respiratory distress. His MD prescribed antibiotics for his lungs and made it worse. He was told to get the flu, DTaP, COVID, and other vaccines immediately after all of those. He got those within, a few days, immediately developed a fever, shortness of breath, fatigue, and chest pains. He was given albuterol for cough and respiratory distress. He developed mucus and productive cough. It persisted. He was given another round of amoxicillin and clavulanate. Again, diagnostic imaging was negative. He took a vitamin D, took a multi, took a zinc, a small amount of fish oil. He felt some benefit from those, but it completely plateaued with his health. So he came to me pretty desperate. He didn't know what to do. And if you haven't seen these cases yet, you will, because it's happening more and more. Now, we did his blood work, and we can see nothing too remarkable in his blood. Nothing that stands out dramatically. Bilirubin, AST and ALT are pretty good. Iron, vitamin D levels were fine because he was taking vitamin D. LDL, nothing in his blood work showed anything, extremely abnormal. His homocysteine was okay. Now, remember, don't assume that he's methylating properly. You want to run a SAMe test. You want to, Doctor's Data has a plasma profile test that I run a lot. His sex hormone binding globulin wasn't too far out of balance. So, based on this, you'd think, well, he's a pretty healthy guy. We did run his Epstein-Barr. There's some evidence that, COVID can trigger a latent Epstein-Barr. And he also had mycoplasma pneumonia. So a previous infection or current infection of that can make COVID worse and more likely to develop long COVID symptoms. So here we ran his hormone test, and we see his adrenals were pretty low, pretty flatlined. His DHEA was bottomed out. I mean, the range is 137 to 336, and he was at 35. And no one ever addressed this. If you go to my website, I give a talk about COVID and COVID nutrition. You can go to my YouTube channel as well. And DHEA was actually low DHEA is a greater predictor of COVID death than was vitamin D. And we all know how strong of a correlation that was. So, and it's why we're seeing also a 3-to-1 male to female death rate with COVID, and a 3-to-1 male to female long COVID rate. More males are likely to get long COVID because of these hormones. So his testosterone level was also very low. His estrogen was, probably a little bit high. And we see if we look at the estrogen to testosterone ratio, it was a little bit high. So, but he wasn't overweight, but he still had a higher amount of of aromatase activity. So this study just shows, I go into this more in my other lectures, but sex hormones and their impact on T cell responses. We need testosterone in order to have proper T cell responses, and also resolution of the inflammatory cytokines. And the sex differences is largely responsible for the mosaic of response to COVID-19 infections. Everyone likes to blame different variants and whether it's the virus or not, but it's actually the body's response to the virus that determines the course of illness. So the double-edged sword of testosterone's role in the COVID-19 pandemic, a great article in the Frontiers of Endocrinology. Low incidence of childhood COVID is linked to low expression of the ACE2 receptor. Androgen receptors regulate the ACE2 receptors in the transmembrane proteins. Low testosterone, or if it's too high, like pathologically high, or if someone's taking way too much testosterone, then we get ACE2 dysfunction and therefore more access by the SARS-CoV-2 virus. So low testosterone, in general, low testosterone, you get an increase in the ACE2 receptor expression. And so that's what allows the COVID-19 or the SARS-CoV virus to infect. And in some of these studies, some of these brilliant hospitals, we're not the only one thinking about this, right? PhDs, there's some PhDs that sound exactly like us functional medicine doctors. And there were some hospitals that were actually using 5-alpha reductase inhibitors. And it had a tremendous impact in dampening COVID-19 severity. COVID-19 leads to hair loss in males versus females, 71% of males versus 21% of females. So low testosterone is kind of the perfect setup for COVID-19. So he wasn't getting better, and it was largely because his hormones weren't there to prime and operate his immune system and inflammatory system. He also had a little bit low melatonin. Melatonin is also critical for immune function in COVID-19. So we focused on his mitochondria, hormone restoration, nutrient repletion. I have COVID-19 long hauler protocols. If you want, again, you can email me or take my classes. In addition to his multivitamin fish oils, we initiated that protocol. We got him on the anti-inflammatory diet, started with slow exercise. We got him in the hyperbaric oxygen. Like I said, it's a critical component of my practice. And we did some IV nutrition if needed. I go through how I do my modified Myers and my protocols in my resource kit that you get if you go through my classes. So long-term post-viral support, methylation. We use mushrooms and glycans, zinc, vitamin D, omegas, N-acetylcysteine, milk thistle, the testosterone renewing herbs like we talked about, melatonin, DHEA, adaptogens, andrographis is really important. L-carnitine, this is where we get into the mitochondrial support. A lot of people that are doing long hauler treatments, they're not focusing enough on the mitochondria. So CoQ10, anti-inflammatories like curcumin and resveratrol. I also really have a good benefit with olive leaf extract. A little, and what I'll get to here is a really important clinical pearl about dosing DHEA. Okay, so stay tuned. I know we're just a few minutes over, but we're almost done. So at 3 months, his DHEA levels doubled. We still want to, increase the DHEA levels, but we put him on, I think, 25 milligrams. And his morning cortisol went up. That morning cortisol is the most important in terms of adrenal health. It's the first to go in adrenal fatigue, and it's the first to come back as the adrenals start to rebuild. But his testosterone levels did go up. His testosterone levels also increased significantly, but after 3 months, we wanted to increase it a little more. So we added a little more DHEA. We added the testosterone renewing herbs. And in my experience, adding pregnenolone to DHEA supplementation dramatically increases DHEA absorption. Also, with some patients, you need to do transdermal DHEA. A lot of the DHEA, most of the hormones, this is why I don't like doing oral progesterone or oral testosterone. Most of it gets sulfated in the liver. and the half-life is 2 to 4 hours. So it's not very effective at repleting levels. So transdermal remains one of the most effective ways of repleting all of your hormones. And the key, though, if you're going to do transdermal administration, you've got to do saliva testing. Then saliva testing blood testing will not be accurate. The only serum testing is not accurate when you're doing transdermal. You've got to do saliva. So we did that. We retested. Okay, his DHEA levels went up a little bit, but that's okay. We got to see that that it actually went to where we want it to be. And so, in just a few more months, his adrenals came back. And look, adrenals, in the best cases scenarios, adrenals take 6 months to a year. And he was 57 years old. So his testosterone levels went up. His progesterone levels went up because we were giving him pregnenolone, but they were still, in okay levels. But now it's okay to drop him off on the pregnenolone. Pregnenolone feeds progesterone and enhances DHEA absorption. So I do those two together a lot. So that's a really big clinical pearl if you're having trouble. So after 6 months, he feels back to normal. 9 to 12 months, he's better than he's ever felt. We've done testing and treatment for heavy metals, neurotransmitters, cognitive plasticity, athletic performance. So he's a full functional medicine patient now. And this protocol that I've given you has worked in over 90% of the cases that I've treated. So, and that hormonal piece was the key, in my opinion, for him and in many other of these long COVID and post-viral. So in conclusion, testosterone is involved and it's crucial in every life stage from conception to old age. It's essential for immune, reproduction, metabolic, hematologic, cardiovascular, and we are seeing an epidemic in the decline of testosterone levels and function. And the causes are multifactorial, from SNPs to the environmental exposures, like we talked about today. Proper testing using the saliva and blood is imperative for diagnosing. And we have a huge array of tools in our tool bag for natural and highly effective treatments, including diet and lifestyle nutritional support. Remember that three-legged stool, okay? And the testosterone herbs, DHEA, pregnenolone, adaptogens. We have more than enough evidence-based treatments to help the hundreds of thousands of people that are suffering with hormonal imbalances. So I want to thank you guys today for paying attention. If anyone's interested in my educational opportunities, I have a certificate, a certification course in nutritional pathology and functional medicine. It's a legit course. It is a very rigorous. It's very easy to understand, but it's rigorous, very thorough. I go into everything from methylation and how to interpret blood work, how to interpret labs. I make it very, very practical. What do you need to become a successful functional medicine practitioner? There's 6 modules. We go into blood chemistry, case studies, inflammation. Module 2 is immunology and autoimmune. Module 3 is gastroenterology from A to Z. Everything you want to know about functional gastroenterology. Module 4 is endocrinology and the hypothalamus and pituitary and adrenal axis. Module 5 is endocrinology and preconception planning and detoxification. Module 6 is cardiovascular, mitochondrial medicine, and many, many case studies. So if you're interested, you can go to my website, which is drbrandonlundell.com. I'm giving everybody who tuned in today an amazing discount. I rarely do this. It's $500 off. The program itself, if you buy the whole bundle, is only $29.95, which is a steal. Look, I've been through all of the training programs out there, the IFM and everything, and you're gonna spend a lot more money going through those programs. And what I've done is made it practical, condensed, and very easy to understand and implement. So it's a do-it-yourself course. You download the entire course and you listen to it and follow through with it, and then take a test at the end. So So please call me if you have any questions. You can email me at hhc@drbrandonlundell.com. And I really thank Doctor's Data for allowing me to talk to all of you today. And I know we don't have a lot of time. A lot of you guys probably have to go because it's your lunch hour, but I'll stick around if Doctor's Data will allow, and I'll answer some questions. So thank you.